Hello, good evening, and welcome to My Knee Monday. Yeah, that's it. That's the catchy name that I spent a week thinking up. It was an idea of my good friend Daniel Massey came up with that one. So My Knee Monday it's going to be. So it's going to be a weekly sort of dip into all things related to knee problems. Hopefully you'll be able to help some people understand a bit more about their knee conditions and work out whether they need help or where to find that help. So last week we talked about cartilage tears, meniscal injuries. This week I thought we'd touch on another common condition that I see almost every day in my practice, and that's knee arthritis. So lots of people will suffer from arthritis, and the knee joint in particular is prone to this condition. If you imagine your knee takes all your body weight through it, and probably just doing everyday household activities, walking up and down stairs, crouching down to load the washing machine, empty the dishwasher, these sort of things means that you can create 3, 4, maybe 5 times your body weight in terms of the forces they generate that go through your knee joint. So that's a lot of pressure on that one joint. So when it comes to arthritis, the term arthritis generally means inflammation in the joint. Now, there are 3 main types of arthritis that generally affect the joints. By far the most common one that I would see as an orthopaedic surgeon is osteoarthritis. So osteoarthritis is quite complex, but in very simple terms, it's probably easier to think of it as a wear and tear arthritis. If you imagine inside your knee joint, the joint surface is a nice smooth surface which allows the joint to move nice and easily with little or no friction. So it's a bit like the sort of laminate surface on your worktop or desk at home. Underneath that surface is the bone. So with arthritis, that surface starts to wear a bit thin, can break down in parts, get a bit soft, and it can wear away completely, so you're down onto the bare bone. These changes mean that the joint doesn't move smoothly, and it can become inflamed, cause problems such as stiffness, pain, swelling, all the symptoms that usually associate with arthritis. The other types of arthritis, the other more common type is rheumatoid or inflammatory arthritis, and again, in simple terms, this arthritis starts with inflammation, usually of the joint lining or the capsule that lines the joint. There's a thin layer of cells called the synovium which becomes inflamed, which can become thickened. The fluid in the joint becomes inflamed, and that in turn will lead to breakdown of the joint surface, which then leads on to problems similar to the osteoarthritis picture. Less common causes, things like post-traumatic arthritis. Usually happen after an injury, whether you've either injured the joint surface directly or whether you've had a broken bone or broken around the knee or in the leg, which means that you're putting more weight on one side of the joint than perhaps you were before. Similar to, say, a good analogy would be a car tire or car wheel that's not balanced properly. With time it will wear out on one side more than the other, and this is something that we do sometimes see following injury now, whether that's a fracture or a ligament injury or a severe cartilage injury in younger life. The causes can vary. So they're the main causes. The main symptoms: pain, swelling, stiffness. A lot of people wake up in the morning, the knee's a bit stiff and painful. It eases off a bit after a few minutes, but symptoms can be made worse, and usually are made worse by activities, exercise, walking. Usually at the end of the day the knee can become sore and painful, and for lots of people that can be quite debilitating, can affect their sleep, certainly disturb their sleep if they roll over the wrong way, get sudden pain that can wake them up, and that will affect the quality of life for lots of patients. In terms of treatments, the simple things first. If you look at your lifestyle, look at activities that you do, you can modify them to avoid activities that cause the pain. You can look at your fitness. Exercise is good, so keep moving the knee so it doesn't seize up, it doesn't stiffen up. So keep the knee flexible, keep the muscles around the knee nice and strong, and that can help with pain, help you manage your pain. And also, if you're overweight, and if you imagine simply that your knee is taking your whole body weight through it and more. So if you are overweight and you have knee pain, knee arthritis, if you do manage to lose a bit of weight, then your knee will feel the benefit of that. And many people can see a significant benefit in their symptoms just by doing these simple things. For some people, they need anti-inflammatory medication, painkillers. Always see your doctor about this before you start on these medications. You need to just check that they don't interact with any other drugs you might be taking, or whether you have any risk factors, particularly for anti-inflammatories. But simple anti-inflammatory creams and ointments that you rub onto the knee can help. Other treatments include injections, and there are various injections available, including simple steroid injections, more joint lubricating or hyaluronic acid injections, which can help reduce the inflammation, and also newer injections such as platelet-rich plasma, or it's an injection called N-Stride, which uses your own blood or components from your own blood cells which are injected directly into your knee joint, which reduce the inflammation and help with the symptoms, and can have a significant effect, which can last over 12 months or more in some people. Surgery is always an option. So for many people, once they've tried the non-operative treatments such as the painkillers, the injections, exercise, lifestyle choice changes, then if these things don't work and you feel that your quality of life is being affected significantly, then usually knee replacement surgery is a good option. And for most people, knee replacement will improve their symptoms. It will get rid of the pain, allow them to get back a quality of life and get back to doing the things that they want to do. And probably 9 out of 10 patients have a good result and are happy with the results of the surgery. And lots of people do see a significant improvement in their quality of life. Lots of my patients will tell me it's the best thing they've had done. Quite a few come back and have the other knee done, which probably in itself is a recommendation. So hopefully you've listened to me droning on for the last few minutes, but hopefully you understand a little bit more about arthritis and the different treatment options. Of course, if you want to learn more, you can visit my website at mykneedoc.co.uk, and you can also sign up and get the free knee pain guide, which will not only you'll go through the different causes of knee pain, but also give you the different treatment options available to you. As always, if you are struggling with knee problems, then it's always advisable to get help sooner rather than later, because if you get a diagnosis and start the treatment plan early, then you'll recover quicker and hopefully get back to doing the things that you want to do. So whether it's booking an appointment to see myself or your GP or another specialist, don't delay. Do something about it today and get your life back on track. Don't let the things drag on and affect your life longer than it has to, because there are some simple solutions, and for most people, treated early, making the right decisions, you can potentially avoid surgery, which is what we'd all want to achieve. So any questions, please comment below. Please like or share these videos if you think any one of your friends or followers might benefit from it, and of course post any questions and I'll try and message you back with any answers I might have. But have a good week, and hopefully I'll see you again next week for more My Knee Mondays. And any topics you want me to cover, just leave them in the comments below.